When you're managing diabetes, you're probably focused on blood sugar numbers, medications, and carbohydrate counting. Those things are absolutely important. But there's something else happening beneath the surface that many people don't realize until complications start developing. Diabetes itself, combined with the medications we use to treat it, can create specific nutritional deficiencies that make blood sugar control harder and increase the risk of complications. Today, we're going to discuss 3 nutrients that are frequently deficient in people with diabetes, why these deficiencies matter so much, and what you can actually do about them with medical guidance. Before we go any further, I need to be very clear. This information is educational and does not replace medical advice from your healthcare provider. Never start, stop, or change medications or supplements without consulting your doctor. Your physician knows your complete medical history, your current treatments, and your individual needs. They're the only one who can safely guide your care. Let's start by understanding why people with diabetes are at higher risk for certain nutrient deficiencies in the first place. It's not just one simple reason. Multiple factors combine to create this problem. First, diabetes itself affects how your body handles nutrients. When blood sugar is elevated, your kidneys work harder to filter out excess glucose. In this process, they also excrete more of certain vitamins and minerals than they would normally. You're literally urinating out nutrients faster than someone without diabetes. Second, many diabetes medications affect nutrient absorption or metabolism. Metformin, which is the most commonly prescribed diabetes medication worldwide, is a prime example. While it's highly effective for blood sugar control and has cardiovascular benefits, it interferes with the absorption of certain B vitamins in your digestive tract. Third, people with diabetes often have chronic low-grade inflammation that increases the body's demand for certain nutrients. Your body uses these nutrients to combat oxidative stress and repair damaged tissues. When demand exceeds supply, deficiencies develop over time. Finally, some of the complications of diabetes, particularly kidney problems, can further impair how your body processes and retains essential nutrients. It becomes a difficult cycle where diabetes causes deficiencies, and deficiencies make diabetes complications worse. Understanding this gives you power to take action. Let's discuss 3 nutrients that deserve your attention, starting with one that's closely tied to the most common diabetes medication. Vitamin B12, also called cobalamin, is absolutely essential for nerve function, red blood cell production, and DNA synthesis. Your body can't make it, so you must get it from food or supplements. The active form that your body uses most readily is called methylcobalamin. Research has shown that metformin treatment is associated with a 19% decrease in vitamin B12 concentration compared to placebo over several years. The absolute risk of B12 deficiency was over 11% higher in people treated with metformin. That's a substantial impact, and it happens gradually, which is why many people don't realize they're becoming deficient until symptoms develop. The symptoms of B12 deficiency can be insidious because they overlap with diabetic complications. Tingling in your feet and hands, numbness, weakness, balance problems, fatigue, mood changes, and memory issues can all result from low B12. The challenge is distinguishing whether these symptoms are from diabetic neuropathy, B12 deficiency neuropathy, or both. Often, it's a combination. Here's why this matters so much. B12 deficiency related to metformin and polypharmacy likely contributes to symptoms of diabetic neuropathy, which may frequently be under-recognized. You could be experiencing worsening nerve symptoms that your doctor attributes to your diabetes progressing, when actually part of the problem is a treatable vitamin deficiency. B12 also plays a crucial role in managing homocysteine, an amino acid that damages blood vessel walls when elevated. People with diabetes already face increased cardiovascular risk. High homocysteine makes that risk even worse. Adequate B12 helps keep homocysteine levels in check, protecting your blood vessels. You get B12 from animal foods. The richest sources include clams, beef liver, salmon, fortified cereals, dairy products, and eggs. However, and this is critical, if you're taking metformin or you're over 60, simply eating these foods might not be enough. Metformin interferes with B12 absorption in your intestines. As you age, you naturally produce less stomach acid, which is needed to separate B12 from food proteins so it can be absorbed. This is why testing is important. Medical guidelines suggest monitoring B12 levels in people taking metformin, particularly those who've been on it for more than a year. A long-term study found that after 4.3 years of metformin treatment, the number needed to harm was 8.9, meaning for every 9 people taking metformin for that duration, 1 person would develop B12 deficiency solely because of the medication. If testing reveals you're deficient or borderline, supplementation becomes necessary. Typical doses for deficiency range from 1,000 to 2,000 micrograms daily, though your doctor should determine the right amount based on your blood levels and symptoms. Sublingual forms that dissolve under your tongue can bypass some absorption problems. B12 supplementation is generally very safe because it's water-soluble, and your body excretes excess amounts. However, you should still take it under medical supervision, so your levels can be monitored and dosing adjusted as needed. Now let's discuss folate, also known as vitamin B9. Research has found that folate concentrations in diabetic individuals with proliferative diabetic retinopathy and non-proliferative retinopathy were significantly lower than both healthy subjects and diabetic patients without retinopathy. This suggests a potential connection between folate status and diabetic eye complications. Studies have shown that metformin treatment was associated with a 5% decrease in folate concentration, though after adjusting for factors like body weight and smoking, this effect became less clear. The research on metformin and folate is somewhat mixed, but what's consistent is that people with diabetes, particularly those with complications, often have lower folate levels than people without diabetes. Folate is crucial for DNA synthesis and cell division. It works closely with B12 in processing homocysteine. When folate is low, homocysteine rises, increasing cardiovascular risk. Folate also supports red blood cell formation, nervous system function, and cellular repair processes throughout your body. The relationship between folate and insulin sensitivity is particularly interesting. Research has found that folate concentrations showed a positive association with fasting insulin sensitivity in people with type 2 diabetes. Higher folate levels were associated with better glucose-stimulated insulin secretion in people who were folate deficient. This doesn't mean taking folate will cure diabetes or replace medication, but it suggests that maintaining adequate folate status supports your body's ability to handle glucose more effectively. Every advantage helps when you're managing a complex metabolic condition. Food sources of folate include leafy green vegetables like spinach and kale, asparagus, Brussels sprouts, avocados, and legumes like lentils and beans. These are all diabetes-friendly foods that fit well into a blood sugar management plan. They're high in fiber, low in simple carbohydrates, and packed with other beneficial nutrients. However, there's an important detail about folate supplementation. The supplement form most commonly available is folic acid, which is synthetic. Your body needs to convert folic acid into the active form called 5-methyltetrahydrofolate. Some people, particularly those with certain genetic variations in the MTHFR gene, don't convert folic acid efficiently. For these individuals, taking methylfolate supplements, which provide the active form directly, may be more effective. If you're considering folate supplementation, discuss it with your doctor. Typical doses range from 400 to 800 micrograms daily for maintenance. Testing can help determine whether you need supplementation and whether it's working. Now let's talk about magnesium, which is technically a mineral rather than a vitamin, but it's so critical for diabetes management that we need to discuss it. The prevalence of hypomagnesemia in individuals with type 2 diabetes is approximately 10-fold greater than that in the healthy population. Think about that. People with diabetes are 10 times more likely to have low magnesium than people without diabetes. Diabetes is frequently associated with magnesium deficit. A low magnesium intake and increased magnesium urinary loss appear to be the most important mechanisms that may favor this deficiency. Every time your blood sugar rises, your kidneys excrete more magnesium along with the excess glucose. Over time, this constant loss depletes your stores. Why does this matter? Reduced intracellular magnesium concentrations result in defective tyrosine kinase activity, post-receptor impairment in insulin action, and worsening of insulin resistance in diabetic patients. In plain language, without adequate magnesium, insulin can't work properly at the cellular level. Your cells become more resistant to insulin signals, making blood sugar control harder. Clinical studies demonstrate that type 2 diabetes patients with hypomagnesemia have reduced pancreatic beta cell activity and are more insulin resistant. This creates what researchers call a vicious circle. Low magnesium worsens insulin resistance, and insulin resistance leads to more magnesium loss through the kidneys. The problem feeds itself. The symptoms of magnesium deficiency can be subtle at first. Muscle cramps, particularly at night, fatigue, irritability, difficulty sleeping, and constipation are common early signs. More severe deficiency can cause irregular heartbeat, numbness, tingling, mood changes, and worsening blood sugar control. Magnesium is involved in over 300 enzyme systems in your body. It's needed for energy production, protein synthesis, muscle and nerve function, blood pressure regulation, and glucose metabolism. It's also crucial for maintaining normal heart rhythm and supporting bone health. Food sources of magnesium include nuts and seeds, particularly pumpkin seeds and almonds, leafy green vegetables like spinach and Swiss chard, avocados, black beans, and whole grains. Dark chocolate is also a good source, though portion control matters for blood sugar management. However, even eating magnesium-rich foods might not be enough if you have diabetes. The constant urinary loss can exceed what you're taking in through diet. Additionally, some medications, including diuretics and proton pump inhibitors for acid reflux, can further deplete magnesium. Studies have shown that magnesium supplementation increases insulin sensitivity and reduces glucose levels in individuals with or without diabetes. Multiple clinical trials have demonstrated benefits for blood sugar control, though results vary between studies. A comprehensive analysis of multiple studies found that magnesium supplementation can improve glucose metabolism in people with type 2 diabetes. For supplementation, the most absorbable forms include magnesium glycinate, magnesium citrate, and magnesium malate. Avoid magnesium oxide, which is poorly absorbed and primarily acts as a laxative. Typical therapeutic doses range from 200 to 400 milligrams daily, though your doctor should determine the right amount for your situation. Take magnesium supplements with food to improve absorption and reduce digestive upset. Evening dosing can be beneficial because magnesium supports relaxation and sleep quality. However, be cautious if you have kidney disease, as impaired kidney function can lead to magnesium accumulation. This is why medical supervision is essential. Now let's discuss practical steps for addressing these potential deficiencies. The first and most important step is getting tested. Don't assume you're deficient or not deficient based on symptoms alone. Many symptoms are non-specific and could have multiple causes. Ask your doctor about checking your B12 level, especially if you're taking metformin or you're over 60. Request a test for serum B12, or better yet, holotranscobalamin, which is a more sensitive marker of true B12 status. Folate testing can be done through serum folate or red blood cell folate measurements. For magnesium, request an RBC magnesium test rather than just serum magnesium. Serum magnesium only reflects about 1% of your body's total magnesium and can appear normal even when you're deficient. RBC magnesium measures the levels inside your cells, which is more accurate. If testing reveals deficiencies, work with your doctor to determine appropriate supplementation. Don't self-prescribe high doses of supplements based on internet recommendations. What's right for one person might not be right for another, especially when you're managing diabetes and potentially taking multiple medications that could interact with supplements. Focus on food first whenever possible. Eating nutrient-dense whole foods provides vitamins and minerals in forms your body recognizes and uses efficiently, along with fiber and other beneficial compounds. Supplements should supplement a healthy diet, not replace it. For blood sugar-friendly meals that support these nutrients, consider building your plates around lean proteins, non-starchy vegetables, and modest portions of whole grains or legumes. A salmon fillet with steamed asparagus and a side salad of spinach and avocado provides B12, folate, and magnesium along with healthy fats. A lentil soup with leafy greens offers folate and magnesium with blood sugar stabilizing fiber and plant protein. Eggs with sautéed spinach and mushrooms for breakfast give you B12 and folate. A handful of almonds as a snack provides magnesium and healthy fats. Black bean and vegetable chili offers magnesium, folate, and fiber. These are simple, practical meals that support both blood sugar control and nutrient adequacy. Monitor your response to any nutritional changes. If you start supplementation, give it time. Nerve healing and cellular changes don't happen overnight. It might take several weeks to notice improvements in energy, and several months to see changes in nerve symptoms or blood sugar patterns. Continue checking your blood sugar regularly because improved nutrient status, particularly magnesium, can affect how your body responds to diabetes medications. If your glucose control improves significantly, you might need medication adjustments to avoid low blood sugar. Let me address some common questions and concerns. First, can you take too much of these nutrients? Yes. While B12 is quite safe even at high doses, excessive B6, which people sometimes take thinking it helps with neuropathy, can actually cause nerve damage. Folate in very high amounts can mask B12 deficiency, allowing nerve damage to progress. Excess magnesium causes diarrhea and can accumulate to dangerous levels if you have kidney problems. This is why medical supervision matters. Your doctor can order appropriate testing, recommend safe doses, monitor your response, and adjust as needed. They can also identify potential interactions with your current medications. Second, will supplements cure diabetic complications? No. They won't reverse established damage or replace proper diabetes management. What they can do is support your body's natural healing processes, help prevent further deterioration, and potentially reduce the severity of symptoms. Think of them as part of a comprehensive approach, not a magic bullet. Third, are expensive specialty supplements better than standard versions? Not necessarily. What matters is getting an absorbable form at an appropriate dose, not fancy marketing claims. Look for supplements that have been third-party tested for purity and potency. Certifications from organizations like USP or NSF provide some quality assurance. Finally, can you just eat better instead of taking supplements? Sometimes yes, sometimes no. If your deficiency is mild and you have good digestive function, improving your diet might be enough. But if you're taking metformin, if you're older, or if you have significant deficiencies, food alone might not correct the problem quickly enough. Most people end up needing a combination of dietary improvement and targeted supplementation. I want to emphasize something important about expectations. Addressing nutritional deficiencies is part of good diabetes management, but it's not a substitute for the fundamentals. Blood sugar control through medication, diet, and exercise remains your foundation. Regular monitoring, foot care, eye exams, and cardiovascular risk management are still essential. Nutritional optimization supports these efforts. It doesn't replace them. The goal is creating a comprehensive approach where every element works together. Proper medication use keeps your blood sugar in target range. Healthy eating provides nutrients and stable glucose levels. Physical activity improves insulin sensitivity. Stress management supports hormonal balance. And ensuring adequate vitamins and minerals gives your body what it needs to function optimally despite the metabolic stress of diabetes. One more thing worth mentioning. If you're struggling with unexplained worsening of nerve symptoms, increasing fatigue, mood changes, or poor wound healing despite reasonable blood sugar control, don't dismiss these as just diabetes getting worse. Mention them to your doctor and ask about nutrient testing. Sometimes what seems like progression of complications is actually a treatable deficiency. Now, I'd love to hear from you in the comments. Are you taking metformin? Have you had your B12 or magnesium levels checked? If you've experienced improvement from addressing deficiencies, what changes did you notice? Your experiences can help others watching this video. If you found this information valuable, please hit that like button. It helps other people with diabetes discover this content when they're searching for ways to manage their condition more effectively. And if you haven't subscribed, click that subscribe button and turn on notifications for new videos about diabetes management, preventing complications, and optimizing your health. Share this video with anyone you know who has diabetes, particularly if they take metformin. The connection between this medication and B12 deficiency isn't widely known. Even among people who've been taking it for years, you might be giving someone information that helps them understand symptoms they've been experiencing. In my next video, I'm going to discuss another aspect of diabetes management that doesn't get enough attention, the role of sleep quality in blood sugar control. We'll explore why poor sleep makes diabetes harder to manage, how diabetes affects sleep, and practical strategies for improving rest. Make sure you're subscribed so you catch that one. Until then, remember that managing diabetes successfully involves paying attention to details beyond just blood sugar numbers. Your body needs proper nutrition to heal, function, and stay resilient against complications. Taking care of these nutritional needs is taking care of your long-term health. Small, consistent actions add up to meaningful improvements over time. Take care of yourself, stay informed, and keep working with your healthcare team. I'll see you in the next video.